Okay, hello health science students. This is Patricia Harris. I'm going to show you the new version of safeMedicate. It's basically just a new updated look for 2018, and I want to introduce it to you because it's going to become the standard for safeMedicate, and your summative assessments and your formative assessments from now on will be in this new version. Really nothing's changed other than the way that it looks. So let's take a peek. You might have noticed that the essential skills has popped up in your module list. And it's now the Essential Skills 2018. This is becoming the new one. It's going to override the old module, so we need to get used to using it. What you might also have noticed is in your modules, when you go down to practice your skills, that you can choose the Essential Skills 2018 here as well. And from there, you can also pick, as you've always done, whether you want to practice your skills in tablets, in liquids, in injections, or in IVs, if that's something that you need to do for your assessment. Let's have a look at what the new tablets and capsules question design looks like. You'll leave your assessment type as the ADA assessment, and that's something that we'll use for your summative. For practicing, it's good to get feedback after every question. Progression point 1 is absolutely fine for when you're practicing, and the mixed difficulty is also good for practicing. So as you'll see, really there's no difference to the old version, except it's given you these two extra bits of information, one on the left hand side of your screen and one on the right hand side. But all the information you need to actually do the drug calculation is still there, it's still in the middle, and it still looks very similar to the old version. You have your dose, so what you want to give, and you've got what you have in your stock, which is what you've got and what it's in. So if we plug that into our equation for this example, we've got what we want to give, which is 5 milligrams. What we've got is 5 milligrams, and what it's in is 1 tablet. When we do that calculation, 5 divided by 5 gives us 1, and 1 times 1 equals 1. Your liquids, again, all the information you need is in the middle, and that hasn't changed, and the two bits down the side are just extra information. Makes it look a little bit more realistic, because whenever you see the drug charts on placement, it's not just that single bit of information in the middle. You will also get extra bits of information about the patient, so it makes it a little bit more realistic. Same thing for the injections. Information you need is all in the middle, and these extra bits down the sides are just to make it look more realistic. Okay, finally, let's have a look at the new IV infusions. Keep everything the same. And I always suggest that you go with the extended version. You can choose to do the drop rate denominator if you like, but I think the extended version is a bit easier to understand, and it's the one that I always encourage students to use and the one that I teach too. So it does look a little bit different, but all the information you need is still there. So in terms of the volume that you need to give and the time that needs to be given over, and then for the second part of the question, it will require you to know the drops per mil. The only difference is that we have this extra information over here on the left, but you don't need to know that to be able to work out your IV infusions. So just to summarise, nothing much has changed except for the fact that you've got some extra bits of information on the left and the right, but you'll do your drug calculations in exactly the same way and use the same bits from the tables as you always have. And your formatives and your summatives from now on will look like this new version. If you are having any difficulties with it, please do get in touch. My email address is at the beginning of this presentation, and I also have my academic support drop-ins for health science students, and you can see those advertised on your blackboard and on posters around campus. Best of luck!